And this one, if anybody's ever been through menopause, can say, okay, I know that there is a brain component here. I've either had anxiety or I've had some sort of depression or I get these flush things that go on and I want to just take off everything and fan myself down. So those all have to do with the brain. So it's not just a hormonal imbalance. That hormonal imbalance also drives neuronal imbalances. Autoimmune diseases. Unfortunately, autoimmune diseases have a very bad name, and the reason why is when your body reacts the way it does in the autoimmune disease and heightens your immune response, then it also turns on your brain to an inflammatory response. And that inflammatory response is what tends to kill cells. And that's what we're going to spend some time tonight talking about, how gluten can affect the body and how that can lead to insulin resistance as well. Cardiovascular disease. Scary thing is cardiovascular disease has a very strong tie into a lot of the disorders. Depression, schizophrenia is one of them, bipolar. Alzheimer's also has some cardiovascular ties there. So this is one that, you know, genetically, if we're predisposed, we should already be thinking 20, 30 years down the road. But if we don't have a genetic predisposition for this, that doesn't matter. 50% of Alzheimer's cases have a genetic tie. The other 50%, they're not really sure of exactly what is the cause. Alzheimer's can have so many causes that affect it that we don't even know. We're grabbing at straws. It's just about everything that can show up. So I'm going to jump ahead one real quick here, Doc. So precursors for Alzheimer's, because this is our next area we're going to be discussing. What I did is there's about 3 slides here of symptomatology. So what I'm trying to do is have you guys think a little bit more farther in advance. Let's be proactive. Do I have any of these things? Should I start thinking about what can I do to support my brain along with my body to help prevent this type of issue showing up? Reduced or absent dream recall. Does anybody not dream? I usually get at least 1 or 2. And I have quite a few patients that tell me, I don't remember the last time I had a dream. That's my first signal. Then I start thinking, let's look at your brain. What else can we do to support your brain? Because if your brain is not working,